Let's talk about treating necks. Now, it's a really common thing. Patients come into me and ask me about what they can do for their neck. And it's one of those areas that if you don't select patients properly, it can be a very disappointing treatment. And this is one of the areas where there's so much you can do for the neck, but there's also slight improvements to be made in certain cases. So it's about going to a really honest practitioner to give you an honest opinion. This lady here, my first question to them is surgery, no surgery. If you wanted to create a drastic result for this, you'd really be looking at a surgical neck lift. Now, for some people, that's not an option. They don't want surgery, don't want to do the downtime or the risk associated with the surgery, and that's completely fine. What we'd suggest then is what is your expectation? What is the goal of the treatment? Because if you come in and want your neck to go all the way back like that, well then there's no point us intervening because we can't achieve that for you. What I would say for this kind of thing is that we can do a few things. We can do anti-wrinkle treatments, we can do lasers, we can do skin tightening treatments. But the maximum benefit I can give for this kind of treatment is probably 20% improvement. Here is a very common thing that we get. These necklines, they also call them tech neck. So it's from sitting at the computer all day and we're like this and we have those lines forming there. These are really cool. It's one of my favorite treatments to do because I can put filler into the real superficial layers of the skin there and we can smooth this almost completely. It's a really beautiful treatment to do. And for an unknown reason to me, it seems to last forever. I'm not sure exactly why, but I've got some patients that have had this done. It's 2 or 3 years down the track. It still looks beautiful. Here is another really common thing we get here at the clinic, and it is a fullness under the chin. Now, we look at fullness in a couple of different ways. There can be fullness from excessive adipose tissue or fat under the neck. The other cause for it, and that's the reason I've grown my beard, is that if your chin is too far back, then it can appear like you have a fullness under the chin, even though you don't, because the chins that are further out, they have more of an angle there. We might be able to bring the chin forward and reduce the appearance of under chin fullness just by putting some filler in the chin. Similarly with under chin fullness that is caused by fat, the gold standard for this is liposuction. You cannot beat it. So for some people, surgery is not an option. We can do fat dissolving injections under there or fat freezing under there. Again, this is all about expectation management. So if you wanted an improvement, not a complete fix, and you are happy to understand that you might get a 30 to 60% improvement under there with multiple treatments, then fat dissolving injections may be the option for you. This one here is a general aging of the neck, and what you'll also find if you look at the lower part of her face here, she's lost a little bit of fat in what's called the pre-jowl area. So the area that's in front of the heaviness, we call this part the jowl there, and putting a bit of fullness in there can really help to define that jawline. The hallmark of a youthful jawline is a straight jawline. So if we can replace that volume in here, we can really make that jawline nice and sharp. What's happened here is that she has some laxity of something called the platysma. It's the muscle that lies in the fat of the neck. It's a very superficial muscle, and you can see that there is some laxity of that. She's getting some platysmal bands forming. For her, the option is going to be a surgical facelift. And now barring that, there are things we can do to improve it, but they're only going to make a 10 to 20% difference. Now, another important point here is that when we're doing cosmetic medicine treatments, there should be 2 goals. One is to improve the appearance of an aging part of the body, so that whether it be the face or the neck. The other one's to stop it from getting any older. A part of the reason we do these collagen stimulating treatments and collagen injections and threads and things that will rejuvenate the skin is to stop it from looking any worse than what it does already. So that is something that is a real understated goal of these cosmetic treatments. Here is a really interesting neck, and this makes a really good point about the practitioner that you see when you're getting cosmetic treatment done. In the cosmetic medicine industry, there is a wide variety of practitioners out there. There are enrolled nurses that have done about a year of education and they work under the supervision of a doctor, all the way through to professors of plastic surgery that do this. And there's a very wide scope of practice. This is an example of why in cosmetic medicine, you need to first practice real medicine. And you can see this fullness in the lower part of her neck there should not be ignored, because it is likely that she has some form of mass in the neck, and that should be investigated by someone other than the cosmetic practitioner. So should go to her GP, have this investigated, ultrasounded, working out what is wrong there before we touch that neck at all. So it's a reminder that these cosmetic treatments, they are real medicine, and you need to have a real doctor assess you prior to having any treatments done.